Those are supposed to be moles. Okay, so you ready?
Mm-hmm.
So you're going to start with inspection, and you're going to identify the 4 quadrants and the 9 regions. So you have right upper quadrant, left upper quadrant, left lower quadrant, right lower quadrant. Regions: right hypogastric, epigastric, left hypogastric. Then you have umbilical, right, what is this? Right lumbar, left lumbar, hypogastric, right inguinal, left inguinal. Okay, so we're just going to identify those. Then we're going to inspect. We're going to look at the skin. Look at the skin tone and appearance. Make sure that it's smooth, dry, even in color. Looking for striae or scars for evidence of any surgeries. Rashes, lesions, and masses. If we see any lesions, we'll identify those using the ABCDE method. And then we're going to check for skin turgor. So we're going to pinch the skin and check for skin turgor. Then we're going to get down on this level and look for any peristalsis or abnormal pulsations. Then we're going to look for our aortic pulsation. If we see the aortic pulsation, then we're not going to palpate it. We're going to look at the shape and contour of the abdomen. It should be flat, and that means they have appropriate weight and muscle tone. If it's scaphoid, that's sunken in. They can be dehydrated or very thin. If it's rounded, then that's slightly overweight, and they may have a little sub-Q fat. If it's protuberant, that's bigger. That means it is distended with pregnancy, obesity, maybe a tumor, maybe ascites. Then we're going to look at the umbilicus and note its contour, if it's inverted or extroverted. Location is midline, any signs of inflammation or hernia or discoloration. So that is inspection. Next, we're going to auscultate. We're going to auscultate for bowel sounds, venous hum, friction rub, and bruits. Bowel sounds are active, hypoactive, or hyperactive. Normal is 5 to 30. And if it's less than 5, it's hypoactive. It's over 30, it's hyperactive. Very active is borborygmus. Absent is less than 5 per minute, but you got to listen for a full minute to say that it's really absent. So I'm going to put the stethoscope in all 4 quadrants and listen. Okay.
Do we start at the lower right quadrant, or does it matter?
I always start right lower quadrant, okay, just to make everything in a habit.
Okay.
It doesn't really matter, but you won't. Yeah, it does actually. Start right lower, right upper, left lower. Okay. Then you're gonna listen for a venous hum. Venous hum is over the liver, and it is a no, it's not. It's umbilicus. It is a high pitched sound, and you listen over the epigastric area and the umbilicus. Then you listen for a friction rub, which is a grating sound, and that's over the liver and over the spleen. And you don't have to say this, but it's because it's the when the peritoneum, when the sac is inflamed and it's rubbing over those areas, then you're going to hear a grating sound. So it's like sandpaper rubbing together. And then you're going to listen for bruits in the aorta, in the renal arteries, the iliac arteries, and the femoral arteries. So you use the bell. So then you're going to, if you want to say all that, say that's what you're going to do, and then listen for bowel sounds, and then go back and listen for the bruits. You can do that too.
Okay, so say it first.
Yeah.
If you want, and then go back and listen to it.
Yeah. Okay. So then you're going to percuss. You're going to percuss all over the areas of the stomach, and you're going to listen for tympany. That's what you should hear. And then over the gastric air bubble in the stomach. So you're going to start right lower quadrant. Okay. Then gastric air bubble is at the 5th or 6th intercostal space, mid-clavicular line. And if you can percuss here, you might hear a little tympany. If you don't hear anything, you can turn them on their right side, and then the air will move up, and then do it again. You might hear it. If they have a full stomach, you're not going to hear it anyway. Okay. Then you're going to palpate. Light palpation, right lower quadrant, all the way around. And you're palpating for superficial pain organs, masses, muscular resistance, any abdominal tenderness or inappropriate rigidity. Then deep palpation, you're also going to palpate for tenderness. You're going to go a little deeper, push down deeper, same thing. And then you're going to palpate for the liver also and the spleen, like this. Put one hand behind, one hand on top, palpate for the spleen. Then you're going to palpate for the aorta. You're going to just put your fingers there and feel it. And then when you feel it, when you find it, just put your fingers on either side of it. And if it feels like it's more than 10 centimeters, you're just kind of walk down and see if it's getting bigger as you go down, okay? But it should just be like right there, okay? Then superficial abdominal reflexes. You're going to take your reflex hammer. This is reflex hammer. Going to take the pointy end of your reflex hammer and test for super abdominal reflexes. They go in a star pattern. So what you're going to take the end of your hammer and just go like that, like that, like that, and like that. And when you do that, if it's a positive reflex, the umbilicus will just kind of jump toward the reflex. It's not really a great test. It doesn't work.
Positive.
It's a positive abdominal reflex.
That's normal.
That's normal.
Okay.
That should be there. So that is a normal reflex and it should be there. But anytime the abdomen, and you don't have to say this, but anytime the abdominal musculature gets stretched, or there's any muscle separation, pregnancy, obesity, surgery where that's disrupted, it doesn't work. So it'll work on little kids, but that's about it.
Okay.
And it really has very little utility unless the person has like a spinal cord injury and you're trying to assess if that spinal cord injury is progressing. So like say, like they have an injury at L1 and they're numb from here down. But if the cord swells and it starts going up, like if they had normal reflexes today, but then, or these were absent, but these were present, but the next day these are absent, then that spinal cord injury is going upward.
Okay.
So it has very little utility because you're not going to just base that. I mean, you're going to do other things to assess your spinal cord. So that's super abdominal reflexes, superficial abdominal reflexes. And is that it? That's all on that page. So that's, I think that's inspection, auscultation, percussion. I think that's it. All right, yep, that's it.
Oh, that's